Excessive menstrual flow and infertility. Excessive menstrual flow accompanied by blood clots can lead to infertility. What is considered excessive menstrual flow? When menstrual flow exceeds 50 milliliters in one menstrual cycle. 2 or 3 packs of sanitary pads are insufficient. And blood flows out similar to urination. Excessive menstrual flow is a clinical manifestation, not a disease name. Conditions like uterine fibroids, endometriosis, residual uterine cavity, problematic endometrium, pituitary or hypothalamic tumors, and more can all cause excessive menstrual flow and clotting. Simple hemostatic drugs are ineffective unless bleeding is caused by a blood disorder. Excessive menstrual flow due to a blood disorder is not just about heavy menstruation. Bleeding may occur elsewhere, like gums, constipation, rectal bleeding, or wounds that won't heal. These issues are not within the scope of gynecology. The most common in gynecology are uterine disorders, particularly adenomyosis and uterine fibroids. For accurate diagnosis, start with hormonal assessments, 6 hormones, followed by comprehensive 4-dimensional ultrasonography to check for anomalies in the pelvic uterus and adnexa. Subsequent hysteroscopy can reveal the true cause of bleeding and aid in treatment. Precise diagnosis is essential before treatment. Avoid improper use of hemostatic drugs, as this may impede progress and even worsen the condition, especially in remote areas where medical care is distant. Upon discovering excessive menstrual flow, seek prompt medical attention from specialized doctors for treatment. Do not underestimate the situation. Mild bleeding can lead to anemia, affecting quality of life, while severe bleeding may jeopardize life. Bleeding is a serious matter. Do not simply attribute it to heavy menstruation. If bleeding exceeds the normal menstrual volume and lasts for 2 or 3 days, it is undoubtedly not just menstruation. There may be serious underlying issues. Only treating the root cause can bring about a cure. For uterine fibroids, use 3D laparoscopy with fibroid cell necrosis agents. While for adenomyosis and endometriosis, use endometrial cell necrosis agents, melting away the lesions and restoring the uterus to normal, regaining its structural form and a regular menstrual flow, free from bleeding. At Beijing Antai Hospital, after a definitive diagnosis, we implement contract-based treatment with a refund guarantee if the goal is not achieved. First, diagnosis based on the cause, followed by treatment upon agreement.